Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes to continue hustling. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Cool Blue VA, Bridge Financial, 100% Chiropractic, ChiroHealthUSA, ChiroScript AI, Chiro Moguls, The Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from a full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle.
Hey guys, welcome to episode 645 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Dr. Ray Foxworth. And if you want to hear a sponsorship edition from ChiroHealthUSA and everything they stand for, stay tuned for the full episode. Welcome back. This is another episode of the Chiro Hustle podcast. I am so excited today. I've been waiting for Ray Foxworth to do an episode of Chiro Hustle with me for I don't know how long, maybe 3 to 4 years. He's been a faithful supporter and sponsor of the Chiro Hustle podcast. So before we get into why we do what we do, I just want to say a big thank you to the Chiro Health USA team and family for supporting what we do over here at Chiro Hustle. And just a huge appreciation to Dr. Ray for being here with me today.
Glad to be here. Appreciate you letting me in to speak to the family, as we say.
Yeah, so I'm going to let people know our big why. Why do we do what we do? And then we'll go into how you were introduced into chiropractic and your 4 decades within the profession. Is that cool?
Sure.
All right, so our big why do we do what we do over here at Chiro Hustle? Well, first things first is freedom of speech. We know what it's like to be traffic throttled. We know what it's like to be censored and shadow banned, and we would never do that to anyone else. And we believe that the message of chiropractic should be clear and concise and disseminated on multiple platforms. And that's why we do what we do with our freedom of speech platform of Chiro Hustle. We believe in medical freedom and family health freedom. They're not the same things. If you're looking for those things, find yourself a local chiropractor, and I'm sure they can guide you into family healthcare better than anyone else out there. As Dr. Ray and I were discussing, he got a lot of his start working within the VA Medical Center, and they don't do such a good job at taking care of the musculoskeletal concerns and the neck pain and back pain type concerns with people. And as we get a little bit deeper into our philosophy of why we do what we do protect the sacred trust. If you don't know what that is, check out our show notes. You'll learn more about chiropractic than you ever did previously, I guarantee you. It's BJ Palmer's last words. If you don't know who BJ Palmer is, please look up who BJ Palmer is, and you're going to probably fall in love with this profession of chiropractic. We believe in innate intelligence and universal intelligence and subluxation. We also believe that when man or woman, the physical gets adjusted, it connects them to man or woman, the spiritual. And with subluxation, I know that some of the schools are denouncing the word subluxation from their schools. So if you are a student or know students that need this message of real chiropractic, please share this episode with them so that they can get plugged into chiropractic and understand the philosophy of chiropractic. And some of these words will never die, in my opinion. So with that, Dr. Ray Foxworth, welcome to the Chiro Hustle podcast.
Thanks very much, man. I'm looking forward to it.
Yeah, so 4 decades in chiropractic. I'm sure people that know you love and appreciate you and respect you and support you for all your leadership. But how did you eventually say, this is the right thing for me to be a part of? How did you decide chiropractic was something that you wanted to dedicate better than half your life to?
Sure. Well, I tell folks that I went out and I found out everything else I didn't want to do in life. So literally from working at a Firestone, working at a loan company, working for an insurance company, working on a catfish pond, all that stuff in my early 20s. My mom and dad are both chiropractors, and I never really thought about going into chiropractic. It's just what my parents did. And I guess I was 26, 27, went to a state association meeting with them and heard Sig Miller. I don't know if you know that name or not, but he ran the New Jersey Association. He was a chiropractor. And really, that's the first time that I really got the big idea, if you will, about chiropractic. Like I said, from as a kid of a chiropractor, you just knew that's what they did, but you never really heard the full story, if you will. And so I heard Sig that weekend. I'll never forget. Went home the following week, met with my parents, and I said, I've decided to go to chiropractic college. And they're going, what? And I said, yeah, I think I am. And my dad, of course, he says, have you saved up for it? And I opened my wallet. I said, yep, I got $11. No kidding. 2 weeks later, we loaded up our little Datsun B210, my wife and my son, Matt, and we headed off to Kansas City, and I never looked back. But that was when I went to Kansas City and graduated from Cleveland Chiropractic College. The bigger story is I started chiropractic college in 1965, but I didn't graduate till 85. Now, it sounds like I'm kind of stupid or a slow learner, but as I was telling someone earlier, it's because my mom went to school as a chiropractor, worked as a vet tech during the day. So guess who was in the class every night with her? It just took me a while to get it, Jim.
So you started out in 65 and didn't finish till when?
85.
So it was a 20-year curve.
Yeah. So I said I wasn't really exposed a lot to chiropractic, but when I looked back at the whole picture, I went to chiropractic college while my mother was going to chiropractic college. I was 10 years old, but I didn't enroll until 81, and I graduated in 85.
Gotcha. That was the missing link. So you started out going to the classes with your mother.
Yeah.
So I guess that gives me like a nice segue into, I've talked to a lot of chiropractors. I've interviewed probably 1,400 chiropractors in some facet over the past 7 years. And I get all types of different stories about growing up as a chiro kid. Do you remember, were you adjusted since birth?
Absolutely. As a matter of fact, I wasn't until I was probably in my early teens before I knew what a pediatrician was. I mean, my parents, always took care of me and just didn't have that a lot of exposure to the medical world at all. I mean, that's just only thing my mom ever did was she either was a chiropractic assistant. That was her first job. She started at like 14 or maybe 15 or 16. She and my dad divorced, my dad at that time, and she went off to chiropractic college. So, I mean, it's always been, I've grown up in it like the other chiro kids have, no doubt.
So what was it like being a chiro kid amongst your peers?
That part was not so much fun. If you know Kent Greenwalt, I have a similar story that he and his dad had, where your parents are considered quacks. They wouldn't let my parents join the country club. They wouldn't let my folks be part of the Rotary Club. And all of that was part of the stuff that was going on with the AMA. And I don't know if you're aware of this or not, but literally in the AMA's ethics guidelines, there was language there that said it was unethical to associate professionally or personally with a chiropractor. So you had MDs at these groups, at these clubs, and they would not allow chiropractic in, or a chiropractor to be a member of their group. So truly saw the discrimination.
So how did we recover from that? Like, I don't know a lot about that history and that gap in the profession, but I know if there was some, like, the Wilk case when he took the AMA to I think it was like the highest court and won, the Supreme Court.
Yeah. That was the way we overcame that, thank goodness, was the Wilk case. And I believe it was in 1985, Judge Susan Getson-Nanner, a federal judge, found the AMA guilty of trying to contain and eliminate the chiropractic profession. It was a very, very organized effort. And so I think what has changed over time, one of my favorite sayings is some things only change one funeral at a time. So a lot of the old mindset within the medical community, fortunately, is in the past, and I think it was a result of that lawsuit. As a matter of fact, Jim, as a result of that lawsuit, this was 1985 when I went into practice. I got really pissed off because I would request records from a medical doctor or from a hospital, and I'd get this crap of, oh, we don't work with chiropractors, we don't release their records. Well, it pissed me off bad enough that on the heels of that case, I wrote an 11-page letter and sent it to over 500 MDs in my community about who I was, what I did, what my background and training was, when to refer to a chiropractor and when to never refer to a chiropractor. And I included, as part of that court case settlement, each organization within the medical world was required to publish in their journals that their association was guilty of violating Sherman Antitrust Act for trying to contain and eliminate, and then to issue a new policy that it was no longer considered unethical to work with or associate with a chiropractor. And I sent copies of those from the Board of Radiology, Orthopedics, Family Medicine, Physical Medicine, Rehab, all of the major groups. I sent copies of those to let them know why they thought about chiropractic the way they did. And so that literally changed my practice. I got a couple of calls from MDs. One of them said, I don't know who the hell you think you are. Don't ever send me anything again. I said, okay, you're off the Christmas card list. But then another call I got was, we'd like you to come speak to us at River Oaks Hospital. We'd like to come speak to us at University Medical Center, to the neurosurgery department, to the pain management department. No one had ever really reached out to my community, to the medical community, and tried to educate them. And I don't mean to ramble, but I think this is so critical, Jim. We look at how we're treated and how we're perceived and how people work with us as woe is me. We're always bitching and complaining about it. What we don't do, and when we do that and we're saying, why don't you guys do this, or why don't you guys understand us? What that does is that puts ownership of that problem in their lap. And it's not their job to understand us. It's our job to educate, just like we have to educate the public. It became my job to educate the medical community in my area, because that's where a lot of our patients go. And so why not be a resource for them?
So I guess my next lead in would be, do you think because of that suit, even though we won, the damage was done, and there's still like, when something gets burned, like you remember the movie The Shining, when they're like hanging around, they still smell the burnt toast.
Yeah.
Do you think that there's still that aftermath because of that case, even though we won?
We won the case, and quite frankly, probably the rank and file in the medical community don't know about the case. If they read their journals, they may have known about it. But I think it's more the older generations that were really indoctrinated by the AMA and by the medical schools to be anti-chiropractic. And I don't think we see that anymore. Does it exist in pockets? Absolutely. I think primarily among the older communities, because the VA system has been around, and what an amazing experience that was. But because that has been around and we've seen chiropractic integrated into the military, at a couple of different levels, now you're seeing chiropractors being trained with medical doctors, and like in my case, starting the VA medical program, a VA medical center program. Man, what an eye opener, and what a boom to my practice, because they had no idea what we do. It was like brand new information to them.
Yeah. I just think, because I go out all the time, Ray, and I go out and schedule new patients for chiropractors. And I still see like the hesitancy within the public and their appeal towards the profession on a street level. Like I see in 2024 that people are like, I don't believe in chiropractic, or, whatever it might be. And I still think that we have a long road ahead of us to repair the
misinformation.
The misinformation, but the reconnection with what chiropractic really does. And I think that back when we talk about 20 years ago, even, we still have a lot to overcome when it comes to public perception and brand equity and how we can help more people. And as you know, Ray, like people always from the stage, they're always like, yeah, we see 7 to 10%. And that's been the case since I've been a part of the profession for 15 years, and you've been a part for almost 40 years. How do you see we improve that?
I think we improve that by certainly better messaging. And this really is, and we may get into this a little bit later, but that was the whole idea behind the Chiropractic Strategic Plan, or the Chiropractic Future Strategic Plan. I don't know how familiar you are with that, but what we at that time I was chairman of the Chiropractic Summit, which is a group of the leaders in the profession. And Dr. Jay Greenstein and I know Jay, had a great interview with him, by the way. We were asked to facilitate a meeting with the Chiropractic Summit, and then the same weekend with the Chiro Congress, which is the leadership from all the states, state associations. And we did a SWOT analysis. What are our strengths, weaknesses, opportunities, and threats? And out of that, that was in September of 19. Out of that became the Chiropractic Strategic Plan, and its purpose was to address all of the issues that we have in the profession. And what we realized was, with both of those groups kind of landed on the same page, was if we truly had a strategic plan, we could solve everything that we identified as a challenge and a weakness and a threat. And so that's what's been going on for the last 5 years. And I absolutely think it will forever change the landscape of chiropractic in a positive way. Jim, I don't know if you're aware of the numbers or not, but less than 25% of our profession belong to either national association. And the reality, and I'm a strong proponent of state associations and our national associations, but when you realize they only have 25% of our population, that's a problem. That's a hell of a lot of work to be done by a small group of people. And so the main theme behind the strategic plan is unity without uniformity. There are different ways of chiropractic that it's being practiced, and unfortunately, we've been our own worst enemy, shooting inwards toward the profession. And there's a lot more that binds us together than separates the diversity. Like my practice within the spine center, there are some that would have no part of that. I got bashed by some of my colleagues for, being a partner in that group. But the strategic plan seeks to address every one of the issues that hold us back, whether it's payment, legislation, communications, government affairs, research. We have a reimbursement task force and a practice-based research network. All of this work is being done by volunteer chiropractors and leaders from the profession. And I think it will truly change the perception about the profession, and also help improve the profession over time.
Well, just hearing your passion with leadership and how you see a better future for chiropractic because of the organizations that you put the three things that most people don't know that you can give are time, talent, and treasure. And you're talking about how people are donating their time. But as you see these organizations that you support, how does ChiroHealthUSA fashion into everything? And maybe you can give people a quick snapshot on ChiroHealthUSA.
Sure.
and how it helps chiropractic and chiropractors.
Sure. So one thing that I want to stress about the strategic plan, these aren't ideas that Jay and I or just those groups came up. We actually did a survey to the entire profession. When's the last time you saw 4,000 chiropractors respond to a survey? I don't think it ever happened. So we actually gathered input from the profession, not from just an individual or groups, but this was the feedback that the profession gave us that helped guide that strategic plan. So it is by the profession and for the profession. So you ask about ChiroHealth and kind of how I guess, how we came about and how we're having an influence.
Yeah. How does that translate to everything you're doing today?
Yeah, so ChiroHealth started because of a problem I had in my office. I don't know if I've told you the story, but I was taking care of a cash patient, charging 35 or 45 bucks, treating her and her family. She gets involved in an auto accident, and a few weeks later, she gets her explanation of benefits, and she sees what I charged insurance, and she knew I was charging her like 45 bucks a visit. And the lady literally reported me to my state board of examiners and to the attorney general for, as she said, I was ripping off the insurance companies, charging them more. Well, long story bearable, nothing happened to me personally. We didn't have a law against that, but nothing looks right in the eye of a patient when they see that difference. And so it made me start looking at, why is it okay for Blue Cross, Aetna, and Cigna to all pay us a different fee? And that's legal, but I can't have a different fee for my cash, Medicare, underinsured patients with limited benefits. And the reality is you can, if you use what's called a DMPO, a discount medical plan organization. We're actually regulated by the Department of Insurance, and it is no different than entering into a contractual network discount with the Blue Cross, Aetna, and Signal. The difference is you get to set your level of discounts, and we help doctors develop what's called a profitable discount strategy, which kind of sounds like an oxymoron. But when you have this in place, you can, if you are billing insurance, get paid well when it's available, but you still have the ability to keep care affordable for those patients that I mentioned, and you can do it under the protection of an entity that's approved by the Department of Insurance. Now, that's how it got started. My why is I saw my mom when it was just me and my two sisters. I heard my mom crying one night. And my sister asked her, Mom, what's wrong? She said, honey, I'm down to our last 39 cents and I don't know where our next new patient's coming from. And I didn't realize it at the time, but that had such an impact on me that I never, ever want to see another chiropractor ever have to be in that situation. And so from day one, when I formed the company, I decided to give back 5% of our revenue to the profession. And we're over, I think, couple of $1 million now, maybe close to 3. And what I do is we have agreements with about 48 state associations. I donate $1.50 per membership. It's 49 bucks a year for the patient to join, covers them and their family. But out of that, $1.50 of it goes to the state associations, 50 cents of it goes to the Foundation for Chiropractic Progress, and 50% of it, 50 cents of it goes to the Chiro Congress. And it's not uncommon for us to give $50,000, $60,000 a year to all three of those entities. It is just baked into what we do. It's part of our purpose, cause, and passion. My goal personally was to change the perception of chiropractic in my state. And fortunately, I was able to do that. And so just kind of decided to roll it out on a national level.
You made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Cool Blue VA, Bridge Financial, 100% Chiropractic, ChiroHealthUSA, ChiroScript AI, Chiro Moguls, The Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from a full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle. I guess I have to ask you, how did you get so good at understanding what was needed and then creating a fix for it? Like, did you always have a knack for fixing things and understanding business and linear moves?
You know, I do think that I'm a problem solver by nature, and that was certainly a problem I had in my office. And then once I realized that, the reality is every doctor is struggling with that. They're worried about, well, am I doing things right? Am I doing it compliantly? Am I going to get myself in trouble? And so it just kind of became the thing to do. Now, I did have a bit of a history with a network. Our state woke up one day and found out that the state health plan, which covered 195,000 covered lives of our state employees, all the colleges and schools, moved to managed care. And when it moved to managed care, guess how many chiropractors were in those networks? Zip. And so I happened to be friends with the governor at that time. And I said, listen, your Department of Finance and Administration just changed the health plan, and you have chiropractic benefits of like $1,500 a year, but you don't have a single damn chiropractor in any of these networks that you contracted with, which means these people have got phantom benefits. And he says, well, we need a chiropractic network. So literally, I'd been past president of our association. I sent out a letter to all the doctors in the state, got them all to chip in $1,000 a piece. We formed a company then called Conservacare, put in a bid for the state contract, and I won it. And it's like, oh shit, what do I do now? I'd never run a chiropractic network before. So fast forward, we did run that network. We were the network for, like I said, 195,000 covered lives. That's where I got my experience in credentialing, background, all of that, contracting. And I'd served on the Blue Cross Blue Shells credentialing committee. So I had been involved politically, and also I was the Medicare carrier advisory rep for 25 years. So I kind of had a working knowledge of that world.
And I'm sure you didn't do any of that because it was something that you're like, I can't wait to get into understanding how to make this available to everybody. Like, I'm sure it came out of necessity, right?
It really did. And I'll always give Kathy Mills Chang the credit for helping ChiroHealth get on the map, because she happened to speak at our state association meeting. And I'd known Kathy forever and a day. And I had her over to the house after she spoke, and I explained to her what Conservacare was and how we had morphed it into ChiroHealthUSA. And she said, Ray, every chiropractor needs this. And of course, back at that time, there wasn't a bigger mouthpiece in the profession than Kathy. So Kathy really helped us kind of birth and roll it out to the profession.
That's super cool. You know, I can't say enough about what you've been able to accomplish for the individual practitioner, but not only them. I believe that you took this position as the patient came first. And I believe that if everybody took that consideration as the person getting chiropractic services came first, we would have a whole different landscape of how people look at chiropractic, instead of educate people on why they should see a chiropractor, but why a patient should seek out chiropractic, I think would be the next move. And I think you guys have done a tremendous job of at least creating a bridge for affordability for people and reimbursement for the practitioner.
Yep. It really does solve the problem for the patients. And how many chiropractors love to see families? Most everybody. But then how do you structure your fees where, let's say you're charging $75 a visit. Well, you got a family of 5. That's kind of hard to do for a family of 5. So, just things like being able to have a family plan where one member pays this amount, the second a little lesser, the third a little lesser. And we've all done this stuff. I've done everything wrong at some point in time, but figuring out how to do it and move it inside of a vehicle that is compliant, is profitable, and you don't have to, you can literally sleep well at night because you're not worrying, geez, am I going to get audited? Am I going to get fined? All that crap just goes away when you're doing it the right way.
Well, my favorite part of all of this is all I hear chiropractors that run like membership style practices, and they cut out all of the other modalities, and they're like, we adjust people the way we would take care of our families. We run our practice the way we would take care of our moms. And I think that this is really congruent with that ideology and the method behind it. Like, you should take care of families as you would take care of your own, bring them in, smile on the face paper, adjust, high five, see you next time. And I think that takes all of the pressure and stress out of running a practice and building a profitable practice and getting people to stick with care long term. And I always hear from chiropractors that the most fulfilling ones are the ones that have the highest PVA and the ones that have chiropractic patients come for life. And I think that you've created systems that allow people to get chiropractic care their entire existence.
Yeah.
And they can stay under care, and they don't have to go shop around after they finish a big whopping care plan, and which doesn't seem like a lot to me, but to the average consumer, they feel hoodwinked when they get into their second visit and somebody's like, it's going to cost you $2,000 for the next 36 visits. And they're like, what? And you're like, but that's really a deal.
Jim, one of the things that we have learned, because we've done a lot of studying and surveys on patient behavior and what makes them stick and what makes them leave. And this is not just in our profession, but one of the main reasons that people stop engaging with a business or stop engaging with a practice or don't follow through is we don't give them clarity around their obligation, what it's going to cost them, and the finances. And people will leave because of that. When you talk about patients sticking around for a long period of time, I started this strictly for the compliance side. I'd gotten in trouble. But what we found was really using the discount medical plans, kind of like a Swiss Army knife. You can help families. You can, get pay well when insurance is available and still keep the care affordable. What was really interesting to see is historically, if a patient had 12 visits, as the saying goes, when the insurance runs out, the patient runs out. Well, guess what happens when they have a membership and they know what their fees are going to be? They could give when you keep their routine visits at about what their copay was, all of a sudden they don't care whether they have insurance or not because they're paying about the same thing with it or without. So what we ended up finding was the average doctor in ChiroHealth, even though they're using a discount medical plan, their revenue increases about 20% because this is really key. A lot of us in the profession, we say, well, workers' comp or PI might pay $125 a visit, but my cash patient can afford $75 or $50, so I'm going to put my fees at $75. So we try to straddle that. Well, the problem is if you set your fee at $75, but the going rate, if the insurance company thinks you're worth $125, why the hell aren't you charging that? And so we never really had a good mechanism to be able to get paid well and keep it affordable. And the reality is 80 some odd percent of the people do have some form of insurance and they want to use it. And so I don't have an issue with those that want to use insurance or don't. That's up to you. But you mentioned speaking in a language that the patients understand. We need to understand the lens they look through. They are healthcare consumers. And I don't know about you, but I have auto insurance. If I wreck my car, I don't want to take it to a shop that isn't going to accept my insurance. I don't want to pay out of pocket. So we talk about setting things up that are in the best interest of the patient. Absolutely do that. You'll make different decisions when you do that.
Well, after, going through this interview process with you today, we're 30 minutes in. I know we have a little bit time left, but I get to the point where I've scheduled in 10,000 new patients doing chiropractic screenings since 2016, and I see it from their perspective.
Yeah.
And I always let them know, like, look, come in and see us. If you think we're a good fit, stick with us. If you come in for these first 2 visits, you realize it's not the right place for you, there's no strings attached for further care, but I guarantee you one thing, you're going to like us.
Yeah.
And I think that there is a lot of a personality match, but there also has to be a affordability match.
Sure.
And I think today the marketplace for healthcare, there's a lot of more shrewd spending, and people want to get into a place that actually values them. But I also tell them that you're going to be able to see a doctor that's going to be interested in your health concerns, and they're going to do a full exam, consultation, health history, any imaging, and they're going to at least tell you what's going on, how much concern there's, and how they can help you. And I say this is called the relationship builder. We want to make sure that it's the right place for you to show up to, and that you want to continuously come back and tell all your friends and family about us. Right. So I think that what we have to do is we have to mesh the affordability model with the relationship equity part of it, because people now want to be invited in They want to be a part of a community. They want to go somewhere where they know and trust somebody. And really, I tell people all the time when they come and talk to me that the most of the time I catch, the vibe that most people don't take care of their health because they don't know where to go, who to trust, and they're very confused in the medical marketplace. So me being their advocate, I help them get set up and come in and see a doctor. But many people don't have somebody like me that can articulate these types of, formal conversations to get somebody to actually show up and get help. So I think if we did a better job of just understanding the bridge between the money line and the relationship line and the long-term line, we could change the GDP of our nation and our world with chiropractic. But I think so many times, like I said, people don't know where to go or who to trust or what systems to plug into.
Yep. The patient communication is absolutely critical. I jokingly tell doctors, the moment that someone calls your office to schedule an appointment, your job from that point on is don't screw it up. They've already made a decision to come see you. And when I talk about the chiropractic two-step. I don't know if you know what that is, but
I don't.
when a patient calls our office, I think the dreaded question for most front desk staff is, how much is the first visit? Well, we've taught our staff to do the chiropractic two-step. Well, Ms. Jones, it all depends on on what the doctor finds necessary, blah, 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 blah. And we never answer their question. And when you're using something like the model that we have to eliminate that vagueness, it's like, well, Ms. Jones, it does depend on what the doctor finds necessary, but it also could depend on what your insurance company requires, as far as the cost goes. And so it's all on how do you have the conversation and not put up barriers when patients come in. And one of those barriers happens to be the financial side. One of the barriers happens to be, like you mentioned, how long is it going to take? And if we don't answer those core questions, that's what creates doubt in the patient's mind. And they start listening to the birds chirping at home. They weren't there during the consult, during the exam. And, that unfortunately, because some people have negative tapes in their head about chiropractic, it's like, well, I knew I shouldn't have gone because of something they heard at home. And we do nothing but worsen that situation by being vague. What's wrong? How long is it going to take? What's it going to cost, etc.
So would you say ChiroHealthUSA is a one size fit for any chiropractic clinic?
No. As a matter of fact, part of our onboarding process is to make sure you even need ChiroHealthUSA, because a practice that is 100% cash, never steps foot in the insurance world, and you just have one fee for every, your set fee for everyone, you don't need ChiroHealthUSA. But what's interesting is I have conversations with docs, and they'll say, "Oh yeah, I'm an all cash practice." I said, "Man, that's awesome. Do any of your cash patients, are they ever involved in an auto accident or an on the job injury?" "Oh yeah." "Do you take care of them?" "Oh yeah, we'll take care of them because they're already our patients." And I said, "You are not a 100% cash practice. And the moment that you're billing insurance at one fee and you have at a different fee for those cash patients, you're creating inducements, anti-kickback violations. There are fines and penalties. Florida, for example, there are a number of states that have laws against charging more to insurance than you do to private pay. It will absolutely, there are doctors paying tens of thousands and hundreds of thousands of dollars in fines because they're trying to help people, but they're doing it the wrong way. So you don't need us if you're 100% cash. If you refer out your PI, you refer out your workers' comp, you refer out your Medicare, because you can't, if you're not charging your actual rates for exams, x-rays, and therapy on Medicare, it's an inducement violation. If you're giving away muscle stem, it's a violation. Ask Dr. Brown in Iowa, paid $80,000 just for not charging for muscle stem. It's crap out there. Well, if you want to make all the crap go away, use the discount medical plan. If you don't use us, use another one. It just gives you peace of mind, Jim.
I love it. I love it. I love it. So if people wanted to work with you, Ray, and set up themselves with ChiroHealthUSA, where do we send them to?
Send them to ChiroHealthUSA. That's ChiroHealthUSA.com.
All right, guys. So ChiroHealthUSA.com. Check them out. Work with Dr. Ray and his amazing team that supports chiropractic nationwide. I've seen you guys everywhere. Every time I go to a state association and speak, or I do interviews at state associations or large conventions, there's definitely a footprint of ChiroHealth USA there. So I think that everyone should support Ray and what they are doing to support chiropractic. Is there, I know we're almost done with the conversation today, but is there anything that I didn't ask you that you wanted to close out with today?
No, I would just encourage those that truly want to be a part of the chiropractic future to volunteer. We're still looking for volunteers. And I want to make one thing very, very clear. I am very pro ACA and ICA, but the reality with 25% of the profession that's backing them, we cannot accomplish what we need to accomplish. And so that strategic plan is not in competition with ACA or ICA. In fact, it's to come around them and help us accomplish what we're all striving to do, which is to further chiropractic and get it to more people. If we were any other business to only have 10%, 15% of the market after 100 and almost 30 years, we suck. We need to change that.
Well, I think that, as I've learned more and more from talking to leaders in this profession, that we have a long road ahead of us. And if I can do anything within the media realm to create better brand awareness and actually get the chiropractic message out to more people, that's my whole journey of why we do Chiro Hustle. Not only the opener, but the closing is I just want people to understand that chiropractic is safe, affordable, and effective. That's why I started doing our first documentary back in 2015, because I saw that there was a gap in the knowledge of what the public saw. And now I realize that, like you said before we got going, I was doing podcasts before podcasting was cool.
Wow.
And I also knew that if we didn't get to the multiple channels of communication when people were passive listeners, I knew that audio was going to be the next boom. And I knew that people would listen to us while they worked out, while they would drive from school, while they would, walk around the neighborhood. Now you don't even know if people are paying attention because they got one earbud in and you're like trying to talk to them. You're like, what are you doing? They're like, oh, I'm listening to a podcast. So I know that podcast is working. And thank you for being a constant contributor and supporter of Chiro Hustle.
Absolutely.
Dr. Ray, it was a really great episode 645 of the Chiro Hustle podcast. I just want to thank you for being our guest today.
Absolutely. I appreciate it.
All right, guys. Well, that's episode 645 of the Chiro Hustle podcast. I'll close out by telling you all, you're just one story away. Keep hustling. I'll see you guys on the next episode. Bye for now. See you, Doc.
Take care.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.